The most asked question by far is, do I get wet? Hey guys, what's up? Welcome back to my channel, and if you're new here, welcome. My name is Victoria. I'm a 22-year-old woman of transgender experience, and I make mostly LGBT content here on YouTube. If that's your thing, make sure you hit that subscribe button down below so you never miss out on a new upload. Now, hopefully you're coming here having seen part 1. If you haven't done that yet, I'll link it right up here. Pause this video, go watch part 1. Come on back. It's not going to make any sense without it. As most of you know, I had sexual reassignment surgery a couple years ago with Dr. Christine McGinn, and this is my video answering all of your questions. If you want to participate in the next Q&A, make sure that you follow me on Instagram. That is where I ask all my questions. That's where I do polls, all sorts of video requests. So make sure you follow me there. And without further ado, let's get on into today's video. The most asked question by far is, do I get wet? Do I self-lubricate? Can I? Things like that. Those are kind of different questions, but they do overlap. The answer is yes, and also no. It's definitely case dependent depending on your surgeon, your surgery, your body, things like that. I personally do produce self-lubricant, so if my partner were to spend some time down there, I'm not gonna need lube or whatever. If they just wanna like slide right in, it's gonna take some time for me to like get to that point, so it's easier for sure to have lube. I have no shame about that. I do get wet, and even if you didn't get wet, like I would take zero sensation or functionality over having a penis, so it doesn't bother me in the least. Lubricant definitely makes sex more comfortable if you don't get wet, but if my partner is spending the proper amount of time down there, I don't really need it. So, and to answer your question about reaching climax, yes, absolutely, I can climax. This is like, so, I don't care about coming on here and talking about like my downstairs, but I'm just worried about monetization. And guess what, baby? Part 1 was already demonetized. Make sure you click those links in the description, order a WISIO, which gets some merch. Please, baby, keep my lights on. So I'm trying to keep it like PG-13. I do climax. I do self-lubricate. I don't like squirt. But I do get like really, 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 really wet. So do with that information what you will. Rennie9240 asked, how long was the wait for SRS? That definitely depends on your area, your surgeon, the time of year, things like that. So for me, I went in, I want to say January for my first consult, and we scheduled it for the middle of April. So I actually was able to go in a couple months, which some people are on a waiting list for like 2 years. So different countries, different states, different surgeons, they're all gonna have different wait times. I was shocked because I went to one of the best surgeons in the world and she still had a super short wait line. So works for me. I've gotten a few questions about the appearance and the feel, and if someone that didn't know that I was trans would know that I was trans from seeing my vagina. I don't know, because I have only been with one person since getting surgery, and that is my boyfriend who I live with. I don't think so. I think it depends on the person. Like, if you get really significant keloid scars, there could be, you do have a little bit of a V scar on either side, but you really can't see my scar at all because A, I don't keloid, and B, it's just hidden in the creases, so you just can't really see it. Every vulva, every vagina looks different, so really I don't think so. In terms of feeling on the inside, I really don't think so. So I've also gotten a few questions asking to compare orgasm and sex from before surgery and after. Now I will do an entire video about sex before and after, but that's probably not gonna get monetized. So I'm not talking about that right now. But in terms of reaching climax, I personally feel like when you orgasm before, it feels like your genitals are the sun and they are raised throughout your whole body, and it's great. When you climax after surgery or with a vagina, it feels like your whole body is the sun. It feels like you are the sun and the rays are all around you. So I would say it's so much better for me. Also, you know, I was holding myself back so much before surgery because I just hated my body. Oh, there's some emo people walking by. Hi, emo kids. Ghoul Collar J asked, did surgery change your underwear preferences? Absolutely, because before surgery, I would wear a gaff every day. If you don't know what that is, I mean, Google it, I guess. There are a lot of tutorials on how to do it, but it's basically I was tucked every single day. And sometimes I would just wear my gaff as underwear if no one was gonna see me, or I would wear my gaff with underwear over it. Which is so annoying and just uncomfortable. Now I prefer either to go commando, which is amazing because I can just go, not that I go like out, like I'm not dirty and like at work with no panties on, but like I can just like lounge and not wear underwear and not have a bulge. So that's great. But it did change my underwear preferences in that I pretty much only wear thongs and G-strings because I wear leggings and things that show off my butt a lot, and I'm not trying to have like any lines. So personally, I just like thongs and G-strings. He asked, what is the correct process to go about getting SRS? Like, who do you talk to and how do you find a good surgeon? Now, for me, I had just known about my surgeon, Dr. McGinn, for a long time because I'd seen her advertised and seen her on Oprah and things like that. I would first off recommend asking your hormone provider for a list. A lot of the time they will have a list of doctors that might even take your insurance because they know what insurance you're on. They oftentimes, I know ours had a list of different doctors that did stuff, and that's actually how I found my top surgery doctor, so that was cool. So ask your doctor about it, go online, ask other trans people. It really depends on you and what you want. So ask around, look at different surgeons, look at their websites and their results, look on forums like Real Self and like Susan's something, some kind of cross-dressing website. There are a lot of different places where you can find the real results and real people's accounts for how it went. Personally, my two top choices would be the doctor that I went to, being Dr. Christine McGinn in Pennsylvania, or two, Dr. Brassard in Montreal or Quebec, Canada. Star Artist X asked, do I need bottom surgery to fully transition, and does not getting bottom surgery make you any less of a woman? First off, no, it doesn't make you any less of a woman. If you don't want a procedure, you don't have to get anything. That's all here. And literally no one but your partner is ever gonna see what's between your legs. So why does it matter? If that's not what you want, that doesn't make you any less of a woman. There are a lot of people that are born intersex that might have different parts and feel comfortable with what they have, but still identify binary, and that's fine. There's no one type of woman. There's no one type of man. Even if we're talking about cisgender people, it's not always, you know, what you assume between their legs. You know what I mean? So no, in short, you do not need to get the surgery, and it does not make you any less of a woman. For me, before surgery, I didn't feel like less of a woman, but I didn't feel complete. I didn't feel like I was done and ready to move on with my life with other things besides my transition and feel comfortable in relationships. So to put it shortly, no, you don't need surgery to be a woman, and not having doesn't make you any less of a woman. Nobody can make you feel inferior without your consent, and it's no one's business if you have bottom surgery or not. It's literally no one's business. So unless it's from someone like me posting a Q&A specifically asking for you to ask me questions, stay out of trans people's business. Alex Harvey Darby, I feel like I've seen your name so much on my Instagram, so hey girl. Alex Harvey Darby asked, have you experienced any hair growing where I shouldn't? I've heard about that a couple times. I've heard about that a lot as well. Like I said, for pretty much every one of these questions, it's really case dependent. I personally don't have any hair growing inside my vagina or anything for a few reasons. First of all, before getting surgery, some surgeons require, others recommend that you get laser hair removal and or electrolysis in the area in which you're getting surgery. So different surgeons should have a diagram of where you need the hair removed. And while I did have multiple sessions down there, there was still a little bit of hair, but my surgeon thankfully does go in to the inside of the skin and scrapes out the follicles. The reason why not all surgeons do that, is when you're scraping the follicles, you can also damage the nerves. So it's important that you do try and get as many hairs removed with electrolysis as possible, so that even if they do that, it doesn't remove some of the feeling. And the only way that you can really avoid that is by getting electrolysis, laser, and going to a surgeon that knows what they're doing. So, yeah. Going off that question, Bearded Rock asked, does your pubic hair grow back normally after or just patchy? Mine grew back normally. I had a full Brazilian down there, so the hairs that do grow are very like soft and fine, which I recommend for all trans girls, honestly. By all means, get a full Brazilian because it makes all down there so much easier to handle. Patrick Prochaska asked, how long did it take for you to get full feeling back? I would say for full sensation, like 6 to 12 months, kind of. I felt like I was 100% healed at 6 months, but I felt a little bit better after a year. So it's kind of case dependent. I would say I got most of my sensation back around like 5 months or so. Yeah. Calvin CRD asks, how long did you have to wait to get out of the hospital after SRS? This will depend on your healing process and whatever. I think I was in the hospital for maybe 5 days, and then I went to a recovery home for about a week, and then I went to my actual home because I didn't want to drive, you know, 5 hours back. So, a bunch of random letters. Asked, do you still feel some kind of tension while you're doing it, or did it feel better with a penis? I don't really know exactly what you mean by tension. I'm assuming because it's inverted, they mean like, does it feel like tension when it's being pulled and like pushed? I don't feel any tension like that at all. You know, you do have some erectile tissue still in that area, not inside, but on the outside, but that's also normal for cis women. That's why it's kind of called like a lady boner a little bit, because a lot of blood flows to that area. That's the only like tension that I really feel. Sex for me is incomparably better. I have had sex, I have delved deep into worldly pleasures involving my body and things like that, and let me tell you, there is no comparison to the sex that I have now with my body feeling aligned with my mind. Bit Aaron asked, was it hard to get used to like when wearing leggings and such? Not really. I think what was hard to get used to was tucking. Like when I would wear leggings and stuff before, I was always worried that there would be a bulge or that like something would look wrong or whatever. So I was always in my head and always afraid, and now I don't have to worry about it. So I would say no, that there was really not much of a learning curve at all in terms of fashion. In fact, it made my life so much better. Mateo Reese 3109 brought up a good point, asking if I can still climax because I don't produce testosterone. So when you do get SRS, they remove the testicles, and the testicles are what produce testosterone. So I currently produce 0 units of testosterone, where cis women produce around, I want to say 60 units of testosterone. I don't know what exact units they are, but yeah, I produce 0. Now there's not really anything wrong with that, but some people do take testosterone supplements. You can get a cream to put on your dilators when you're having sex or whatever. I don't feel the need to take any testosterone supplements because I am a pretty active person. I work out like 6 days a week. I am very active. I have an incredibly high sex drive, and I don't really feel any need to go on testosterone. I'm not against it. You know, if for some reason my libido went down or I was having trouble, you know, reaching climax, then yeah, we get on testosterone, and that's totally an option for some people, but for me, it just really wasn't necessary. And lastly, Bree VTG asked, what emotions do you feel before and after surgery? Before surgery, I was anxious for sure, because you don't know what you're going into, because it's case dependent. Even if you go to the best surgeon in the world, you don't know how your body's gonna react. So I was nervous. I was, you know, a little bit scared, but overall I was just so ready and so excited to get this over with. After surgery, there were a lot of emotions because you're healing, you're in bed, it doesn't look great, you know, it's painful, all sorts of stuff. So at first, after surgery, while the main feeling that I felt was gratitude and relief, there was still some anxiety and still some fears because I didn't know what the finished product was gonna look like. But thankfully everything went incredibly, and I would do it all again if I had to. Alright, thank you all so much for watching this video. I hope you enjoyed it and I hope it helped. If you did, make sure you give it a big thumbs up. It helps out my channel so much. Like I said, I kind of want to make this a monthly series all about my SRS or even other procedures that I've had done. So please leave in the description box down below anything else you want to know about SRS, maybe a whole themed video about a topic with SRS. I would love to hear from you guys. I also want to say, if you have a question that you want to ask me directly, or if you even want to schedule a one-on-one FaceTime session with me to help you along your transition, your coming out journey, anything like that, I am available on WISIO. I will put a link in the description box down below. That is a great resource for you to reach me one-on-one and get my true and honest response in video form or in FaceTime. Again, I hope you all enjoyed this video. If you did, make sure you give it a big thumbs up and share it with whatever friends you might have that are curious or need some help with their transition or might be undergoing or thinking about undergoing this procedure. I'm sure it'll help them. I will link all my social media in the description box down below, as well as my Amazon merch, Redbubble, and Teespring, so you can check out all of the LGBT merch that I've made just for you. Make sure you subscribe to my channel because I make new videos every single Wednesday, as well as a bonus video about once a month. And until I see you guys next time, good luck. I love you. Bye.